Hi guys, welcome to my YouTube channel. I go by the name Dr. Achievement, and today I'm taking on the topic erectile dysfunction. If you want to know more about erectile dysfunction, or you're having erectile dysfunction, you're not ejaculating more, this video is for you. And this erectile dysfunction topic we'll be talking about what erectile dysfunction is all about, causes of erectile dysfunction. We'll talk about the symptoms of erectile dysfunction. We'll talk about the treatment and treatment from my own point of view, because I don't agree with other topic or other ideas of treatment, especially the use of medications or Viagra use. Though it's for a short period of time, but medicines act in a different way. I'll tell you all about these guys. Please stay tuned, watch to the end, and you'll know more about this. And I promise you, your problems will be solved. So let's go to the next slide. What is erectile dysfunction? Erectile dysfunction, we can call it impotency, is the inability to get and keep an erection firm enough for sex. So having trouble for time to time isn't necessarily a cause for concern. If erectile dysfunction is an ongoing issue, however, it can cause stress, affect your self-confidence, and contribute to relationship problems. Many men are having this kind of situation, we know, like relationship problem due to erectile dysfunction. So in this video, like I told you, you would learn more. I guarantee you at the end of watching, you will have the best idea to solve your problems of erectile dysfunction. Please watch to the end. And I brought some advice, my own advice from my own technical point of view, and you'll get more knowledge about this. So let's just moving. Symptoms. What are the symptoms you basically get for erectile dysfunction? You will get trouble in getting an erection. You get problems in keeping an erection, reduced sex desire. You won't feel like, and unsatisfactory sex. Your partner will want more and you can't satisfy your partner, and that is a big slap. Embarrassment or low self-esteem. In this case, when your partner wants more, you don't satisfy them, you will be embarrassed. I can't please my wife, or I can't please my husband. But basically, we're talking about men, all right? So I can't please my husband, you will be so embarrassed. Relationship problems. It will cause relationship problems. The inability to get your partner pregnant is a big slap again, all right? So let's move in. Causes of erectile dysfunction. Sexual arousal is a complex process that involves the brain, hormones, emotions, nerves, muscles, and blood vessels. We know all this comes and it plays a role in the aspect of causing erectile dysfunction. If any of this is damaged in any way, then you will be basically having erectile dysfunction. So erectile dysfunction can result from a problems with any of these. Likewise, stress, mental health concerns can cause or worsen erectile dysfunction. Sometimes a combination of physical and psychological issues causes erectile dysfunction. So let's dive in, guys. I don't want to waste time. I just want to go to the point, straight to the point, hit the nail at the head, hit the nail in the head, and get this solution solved for you. And I promise you, as you're watching, keep watching to the end, and you get good ideas and good suggestions to handle these issues that has become a very big issues. Okay, for instance, a minor physical condition that slows your sexual response might cause anxiety about maintaining an erection. So the resulting anxiety can lead to or worsen erectile dysfunction. Let's talk about the major causes. Okay, I've already outlined the causes of erectile dysfunction, but let me talk about the major causes. So as you get old, okay, erection might take longer to develop. That is normal for everybody. All right, if you're old and it's taking longer to develop, don't be scared or at all. So sometimes it might not be as firm. You might need more direct touch to your penis to get and keep an erection. Various risk factors can contribute to erectile dysfunction, including we have the medical condition, particularly diabetes. We have heart conditions. We have e.g. heart disease, high cholesterol, high blood pressure. This can contribute to erectile dysfunction. We have tobacco use, which restricts blood flow to your veins and arteries, can over time cause chronic health conditions that lead to erectile dysfunction. Poor sex hormone secretion, especially testosterone. The low testosterone can cause this erectile dysfunction. Why am I going basically on these causes? I want you to know these causes, then we'll know how to treat them. Because if you don't know the cause of your problems, how can you treat them? If you don't know the cause of your problems, then you have no idea at all to treat your problems. All right, so if you know the cause of your problems, you will know the preventions of your problems. So being overweight, especially if you are obese, certain medical treatments such as prostate surgery or radiation treatments for cancer can cause this erectile dysfunction. Injuries, particularly if they damage the nerves or arteries that control erections. Medications including antidepressants, antihistamine, and medications to treat high blood pressure, pain, or prostate conditions. All these things are, and the most big one, psychological issues. If you're having stress, you're having anxiety, and most times if you're having depression, this can lead to erectile dysfunction. So drug and alcohol use, especially if you are a long time drug user or heavy alcohol drinker, it can lead to erectile dysfunction. So let's move down to the next point. The medicines which have been approved, especially Viagra. We know the use of Viagra and Tadalafil. We know the use of Levitra. We know the use of Cialis, and all these medicines are there for treatment. But let me tell you why you should not use them. Medications work in a way whereby it cannot work direct without stopping something. It either stops something in your body, it stops the production of something, and it increases the production of something to decrease the production of something. Like it works in a way, like in the aspect of medicine. If we're talking of mechanism of medicines, medicines works in a way it has to stop something to stimulate something. Either it stimulates something to stop something. It works in a very kind of strange way whereby you're risking something from getting produced and you're increasing something else, and this could lead to another kind of side effects. With Viagra, we have a lot of cases where Viagra is causing heart attack. All right, I'm not the one that is saying this. A lot of research has said that many medicines stimulating the erectile function is causing heart attack. So why you should not use this? You should be very cautious in aspect of taking this kind of medications, and before you buy these medications, consult your doctor, and your doctor to go through thorough checkup on you before you use these medicines, before you drink it and you not wake up because of you want to have sex. Is not a very wise decision. All right, guys, I don't want to waste your time. Like I told you, I don't want to waste your time. I'm just going down to the treatment. Okay, before we proceed to my main treatment, I will tell you my advice. The best way to prevent erectile dysfunction is to make healthy lifestyle choices and to manage any existing health conditions. For example, work with your doctor to manage diabetes, heart disease, or other chronic health conditions. See your doctor for a regular checkup. Like I told you guys, you can't come and start getting treatment without going through your body and knowing what is the particular issues. Like I told you when I started, we listed many things. We say muscles can be involved, blood vessels can be involved, nerves can be involved. So you have to outline and check for this screening test and know which of these places are involved, so that you won't be taking medicine for another something and you won't be getting a result, and this medicine for another something will be affecting you the more and worsening your case. This should not happen, guys. So what you go for your medical checkup, and you think always when we talk about prevention, check the causes. That is why I took my time to make these causes well and obvious. All right, you will check the causes. What are these causes of erectile dysfunction? You have to check the causes, and you have to prevent these causes. So you're smoking too much, stop smoking. You're drinking too much, limit the alcohol use. You're using drugs which are affecting you, stop using these drugs. If you're not exercising, especially obesity as a cause, start exercising. Take steps to reduce your stress or your mental health. Depression, if you're having depression, anxiety, or other concerns, try to reduce them, then you'll be fine. Instead, some people will just be having depression and they will be having this kind of issues. Instead of you to go and start buying Viagra and start worsening your issues or increasing your vasodilation or resulting to heart attack or the rest, why not fix your depression only and you're fine? All right, so this is a idea which I will advise anybody. Very sorry for the background noise, guys. All right, let's just move down to my final point. As a physiotherapy, I don't believe in medications. I know pain relief is essential if you're having pain as a physiotherapy. All I believe in is exercise the muscle. Perform some exercise. Perform something that will improve something. You can't rely on medicine, because medicine blocks something to function. It's either block one thing to function, stimulate one thing, or depress one thing, or the mechanism of medicines, how it is. All right, so you can't fully rely on medicine. So why am I saying this? Exercise is so important. Now we were going through the erectile dysfunction and we check many cardiac issues are there. All right, so why not improve these cardiac issues? If you improve the cardiac issues, improve your vasodilation, improve your you basically unknowingly your body will be improved. All right, so there's no two ways about it. If you're having diabetes and you treat your diabetes, you sort the issues out, basically you will be fine. So in all these cases, you need what? You need exercise. Even if you're needing a stronger pelvic muscle and the rest, what you need exercise. If you need the muscle, the nice blood flow and the rest, and to decrease the psychological issues, what you need exercise. So this is very, very important, guys. So I know many people will start exercise and they will be going so hard. You don't have to go so hard. You just have to check how to start with a little bit exercise. And if you need my help in any way, I'll keep my email in the description below. I'll prescribe a very nice, moderate, simple exercise for you. It will take you little, like my second line was saying, even less strenuous regular exercise might reduce the risk of erectile. You don't have to do too much. You don't have to run for 10 hours. Let me know. I would help you. All right, so discuss an exercise plan with your doctor. Very less exercise, you don't need much. All right, and continuous improving this, and leave all the medications, really all the medications, so that you will not be having a lot of risk. All right, so let's come to the last point: psychological issues. This is so important, guys. Many people are depressed, many people are anxious, many people are stressed out because of work and the rest. Please attend to your psychological health. If you're feeling depressed, always, and if you remember my last video, I was talking about this. If you're feeling depressed, please talk to somebody. Please look for help. Please know that your conditions is not only you that is having it. Tons of people, there's millions of people on earth who is having it, but how to improve should be your number one goal. You find solutions. All right, so this is where I'll end it for today, guys. Sorry for taking much time. I was thinking I will just end the topic in a very short time, but unfortunately I had a lot of things to write, so just so that I can help anybody watching this video, I promise, and I'm so guaranteed that after watching this video you have gotten the solution already. So you don't need to watch all that video, you just have to go straight and start doing the work. All right, go run the checkup on yourself, check what is the causes of yourself, and you find the results, and then you go and start working on that result. But I know basically exercise covers the whole thing, because anything you're having, you need to increase exercise a little bit in the minimum range and you'll be fine. And if you're having depression and the rest, fix it out and leave the rest. All right, you'll be fine, guys. And if you're a medical student and you're looking for a professional textbook, please, I have some links in my description below. Click on the link, go buy textbooks which you want right now. They are giving you some percentage off. Thank me for that later. Please like my video, share my video, subscribe to my YouTube channel if you're first time. Thank you very much, guys, and have a very nice day. Bye.